In this module, I am going to discuss about necrotizing enterocolitis, which is an important condition affecting the gastrointestinal tract of newborn baby and is considered as a gastrointestinal emergency in the neonate. Before we get started, let us look at what are the parts of the intestine which are affected in this condition. The first area to be affected most commonly is the terminal part of the ileum. And the second area which is commonly affected is the proximal part of colon. That is the ascending colon. Okay, these are the two areas which are affected. As you could infer from the name, necrotizing enterocolitis is characterized by inflammation caused usually due to bacterial colonization of the intestine, and if untreated may lead on to necrosis of that part of the intestine as well. What are the risk factors for development of necrotizing enterocolitis? The most important risk factor is prematurity. So it is likely related to immaturity of the gastrointestinal tract in preterm babies. Number 2 factor is top feeds. Top feeds refers to feeding with milk other than breast milk, like for example cow milk or inappropriate formula milk. That is a second important factor. Third important factor is birth asphyxia. Fourth important factor is maternal usage of cocaine. And fifth one which is implicated is usage of H2 blockers in the neonate. These are main factors implicated in the causation of necrotizing enterocolitis. First and the important question to be answered here is, why is human milk or the breast milk considered to be protective for necrotizing enterocolitis? There are so many reasons which have been said. One important reason is it will lower the gastric pH. That means it makes the gastric pH more acidic. This acidic pH prevents colonization by pathogenic bacteria like E. coli. Number 1. Number 2, it also promotes peristalsis of the intestine. Breast milk also contains some substances like lactoferrin, which protects against the growth of pathogenic bacteria like E. coli. And fourth important is it increases the normal gut flora. Always remember this point, whenever breastfeeding is given to the baby, the gut is colonized by good bacteria, and if breastfeeding is not given, it promotes colonization by pathogenic bacteria like E. coli or Klebsiella. Now let us look at how the different factors are involved in the causation of necrotizing enterocolitis. The most important factor, as I told you, is prematurity. This results in immaturity of the gastrointestinal tract of the neonate. Okay. In addition, if this baby is given top feeds, as I told you, this will promote bacterial colonization. I am talking about pathogenic bacteria like E. coli and Klebsiella. So it promotes pathogenic bacterial colonization, and that would affect the immature gastrointestinal tract of a neonate, resulting in inflammation followed by necrosis. That is how classically necrotizing enterocolitis occurs. We also saw the other factors which can result in necrotizing enterocolitis. One includes asphyxia. Birth asphyxia is associated with vasoconstriction of the blood vessel. Suppose I talk about gastrointestinal tract. What are the blood vessels I am talking about? Splanchnic vessel. So it can cause vasoconstriction of the splanchnic vessels, and this vasoconstriction can predispose to necrosis, thereby resulting in necrotizing enterocolitis. The maternal usage of cocaine also has the same effect. It can cause vasoconstriction of the splanchnic blood vessel, predisposing to necrosis. What about the next factor, that is usage of H2 blockers in the neonate? H2 blockers will decrease the amount of hydrochloric acid in the stomach. When the acidity of the stomach is not there, it will promote bacterial colonization. Okay, so as you see, the different factors, namely prematurity, top feeds, H2 blockers, maternal usage of cocaine and birth asphyxia can predispose to development of necrotizing enterocolitis. Next, we have to know how a baby with necrotizing enterocolitis is going to present, or features of NEC. Features of NEC can be remembered by something called as modified Bell staging, which tells you about different stages of NEC as well as help us to remember the clinical features of necrotizing enterocolitis. NEC is divided into 3 stages according to the severity. Initial stage is stage 1, then the stage 2 is the next stage, and stage 3 is the advanced stage, which is for necrotizing enterocolitis. Let us look at the features of stage 1 NEC. Stage 1 is called as the beginning stage, or we also call it as a suspect NEC. We cannot confirm our diagnosis. We may think that possibly the child is having necrotizing enterocolitis because there are no characteristic features in this particular stage. What are the features? First feature would be non-specific abdominal features. Non-specific. That is a key word here. That means the child would have something like abdominal distension and vomiting, with which we cannot make any diagnosis. And in this stage, the child can show some systemic manifestations also in the form of temperature instability, and in between can show episodes of bradycardia or apnea. So as you can see, there is nothing like characteristic feature of necrotizing enterocolitis in this stage 1. That's why it's called suspected NEC. Now, imaging studies are usually normal in stage 1. If you take the abdomen X-ray, it is normal. Stage 1 is divided into 2 further categories, 1A and 1B. It is dependent on the blood in the stool. When you have occult blood in the stool, occult blood in stool, it is stage 1A, and if you have gross blood in the stool, it is called stage 1B. Okay, so this is how stage 1 is classified, and that is the first or the suspected stage of necrotizing enterocolitis. We move on to the second stage of necrotizing enterocolitis. Here, the findings of NEC becomes more obvious and we can diagnose NEC in this stage. So this stage is called definite NEC. Okay, now what are the features of this particular stage? We can divide it into 2 things, 2A and 2B. 2A is characterized by absent bowel sounds, very important feature. And if you take the imaging, that is X-ray of the abdomen of the baby, in 2A, what you can get is a sign called as pneumatosis intestinalis. You can please make a note of this name. Pneumatosis refers to the air and intestinalis refers to intestine. Here actually refers to air in the wall of the intestine. That is a point. Air in the wall of intestine. Right. Normally, we know that air is present in the lumen of the intestine. Now, what happens due to inflammation? Air can track through the lumen and enter into the wall of the intestine. That is what we call it as pneumatosis intestinalis, which is supposed to be one of the characteristic and diagnostic findings of necrotizing enterocolitis. Okay, right. Then we come to stage 2B. In 2B, in addition to the above finding, child also will have abdominal wall edema. Okay, and if you do radiological imaging at this stage, you will get something called as pneumatosis portalis. Pneumatosis portalis. So try to infer the name. Pneumatosis refers to air in the portal circulation. I am talking about portal vein. So pneumatosis portalis means air in the portal vein. Again, a characteristic feature in necrotizing enterocolitis. Okay, and at this stage, we can note some complications if you do the lab testing, which is what we call it as a triad itself. Has been asked as a previous NEET exam question, which you should know about. What is the metabolic or lab triad in case of necrotizing enterocolitis? It includes 3 findings. Number 1 is thrombocytopenia, low platelets. Number 2, hyponatremia, low sodium, and number 3 is metabolic acidosis. Okay, so this is about the stage 2 features of necrotizing enterocolitis. Now we move on to stage 3. Stage 3, as I told before, is the severe stage of necrotizing enterocolitis, because in this stage you will have complications occurring in NEC. That is why this stage itself is called complicated NEC. Okay, or some books use the word advanced NEC. So what are the complications we are expecting in necrotizing enterocolitis? Till now, what were we studying? Something related to the intestine. Now, complication means the problems occur outside the intestines also. I am talking about what is outside the intestine? Peritoneal cavity. So, next stage would be something like bacterial infection of the peritoneal cavity, which is nothing but peritonitis. So, stage 3 is again divided into 3A and 3B, and 3A is characterized by definite evidence of peritonitis. What are the features of peritonitis? Child can have erythema of the abdominal wall, induration, as well as tenderness of the abdominal wall. Okay, very characteristic of peritonitis. Okay, along with that, in this stage you will have definite ascites developing. Okay, this is the clinical features of 3A. Okay, and please remember, all the findings which I have said before also will be present, but in addition there would be definite evidence of peritonitis. Next is 3B. What is 3B? 3B is the stage of intestinal perforation. Okay, the intestine become perforated. Okay, so now you can easily know what would be the manifestation if there is intestinal perforation. Yes, it is air collecting in the peritoneal cavity, or in other words, if you take the X-ray, you will find definite evidence of pneumoperitoneum. Okay, right. The classical finding of pneumoperitoneum on the X-ray would be presence of air or gas under the diaphragm. Very classical finding which you would be able to easily make out in the X-ray. Okay, and we know that intestinal perforation can be treated only by surgery. So that is why this condition is considered as a surgical gastrointestinal emergency in a neonate. Some of the classical radiological findings which I want you to remember here are: number 1, can you see the first picture? This picture which depicts, here is the air in the intestinal lumen, but surrounding that also there is a layer of air like this, right? Here again there is an air in the intestinal lumen, and surrounding that also there is a layer of air. What is the meaning? It is air entering into the wall of the intestine, or this is what we call it as pneumatosis intestinalis. And please remember, pneumatosis intestinalis is a finding which is very, very characteristic of necrotizing enterocolitis. And in which stage it is seen? Stage, yes, 2A. That is where it is seen. Okay, what is the next picture depicting? The next picture is depicting air under the diaphragm. Can you see that this is the outline of the diaphragm which I am just outlining now? You can see very well air below the diaphragm, which is very, very characteristic of what condition? Pneumoperitoneum. And don't forget, pneumoperitoneum is due to intestinal perforation, which is seen in what stage? Stage 3B. Okay, right? So these are some of the important radiological findings which can be put up as image-based questions in your exam, and you should know about it. So now we come to the management of a case of necrotizing enterocolitis. You can see that I have divided the management into stages up to 3A and 3B. Why do you think so? Because we all know that 3B is a stage of intestinal perforation which has to be managed only by surgical intervention, correct? Till stage 3A, there is no intestinal perforation, so it can be managed medically. That is the main difference. Okay, right. So now, how are you going to manage it medically? That is up to stage 3A. First of all, this is a intestinal problem, so you have to keep the baby nil per oral, NPO. So if the baby is kept nil per oral, what would be the mode of nutrition? It is TPN, or total parenteral nutrition, like with the help of IV fluids containing dextrose. That is what we give. Third important thing is, I told that there is a lot of bacterial colonization occurring in NEC, right? So you have to give antibiotics. Intravenous antibiotics are definitely recommended, right? The usual combination of antibiotics recommended are, one is a penicillin group, which is ampicillin. Second is gentamicin, which is an aminoglycoside. And now many of the texts are recommending that to increase the anaerobic coverage, you also give metronidazole. So 3 antibiotics are used in the management of necrotizing enterocolitis. One should also know about the duration of antibiotic treatment in necrotizing enterocolitis. It depends on the stage. In stage 1A, it is enough if you give antibiotics for 3 days. Stage 1B, it is enough if you give for 7 to 10 days. But from stage 2A onwards, that is 2A, 2B and 3A, you have to give antibiotics for 14 days. So duration antibiotic depends on the stage of the disease. These are the main things in the medical management of NEC. Coming to the surgical management, it is 3B onwards, surgical management. What is 3B? It is intestinal perforation, which has to be corrected only by laparotomy. Okay. Laparotomy involves resection of that necrotic part of the intestine followed by anastomosis. That's a usual treatment for the intestinal perforation. You have to seal the defect, resect the part of intestine which is necrotic, and then anastomosis. Okay. Suppose the child is very unstable. Think like this: child is not even taken up for is not stable enough to be taken up for surgery. Then what can you do? You can perform primary peritoneal drainage, which is remembered as PPD, primary peritoneal drainage. Once the child becomes stabilized, then further definitive surgical intervention can be planned. This is the outline of management in case of necrotizing enterocolitis. Now, there is some recent advances in this necrotizing enterocolitis which you should know about, which is mainly related to how to prevent cases of NEC from occurring. Okay, and one thing which they have found to be a significant role is antenatal steroids. We all know antenatal steroids like dexamethasone and betamethasone have an important role in decreasing the occurrence of RDS, which is respiratory distress syndrome, by causing maturity of the surfactant. We all know this fact. However, antenatal steroids also have got a role in promoting the maturity of the GAT, thereby decreasing the colonization of the intestine by the pathogenic bacteria. So antenatal steroids are now accepted to have a definite role in the prevention of NEC. Second thing is something called MEN. MEN is an expansion for minimal enteral nutrition. Okay. Now this is especially helpful in small preterm babies. Okay. Especially babies who are less than 32 weeks of gestation. You all must be knowing that if a baby is hemodynamically unstable, which is common in preterm babies, we don't give breast milk to the babies. We give only total parental nutrition to the baby. Now, it is found out that in those babies, okay, if you can start small amount of feeds, okay, it is found to be very, very beneficial. What is the feed I am talking about? Enteral feeding. That means giving breast milk. Obviously, we cannot give directly breast milk to the baby, but maybe like this nasogastric tube feeds. Through the nasogastric tube, you can give the expressed breast milk. Okay, it is not like for nutrition, you give large amount of milk. It is only minimal amount. So what is this minimal here refers to? Minimal here refers to around 10 ml per kg per day. So for an entire day, it is only 10 ml per kg. So you know that it is not for nutrition of the baby. For nutrition, baby has to receive more amount of milk. So what is the actual role of minimal enteral nutrition? It is for promoting the maturation of the gastrointestinal tract. Promote maturation of gastrointestinal tract, thereby decreasing the occurrence of necrotizing enterocolitis. Okay, so as you would infer now, this minimal enteral nutrition is mainly not for nutrition of the baby. It is for promoting the maturation or growth of the gastrointestinal tract. So that is why minimal enteral nutrition is also called as trophic feeds. We all know trophic refers to growth. So this minimal enteral feed is also called as a trophic feeds. Are you able to follow this? Right. Last one, which is found to have a role in the prevention of necrotizing enterocolitis, is enterally fed probiotics. Probiotics includes the normal gut flora like lactobacillus or some species of bifidobacterium. So what is the role of these probiotics? They prevent colonization from the pathogenic bacteria, thereby preventing the occurrence of necrotizing enterocolitis. Of course, they are very limited to research settings only. There is no definite recommendation for the same, but you should be aware of the fact that they have a role in prevention of NEC. So that is about the discussion of necrotizing enterocolitis. I've told you about the features, bell staging, management, as well as prevention aspects of NEC.